Hey everybody, this is Lane. I'm currently sitting outside a hotel in DC, so if the quality of this video is not that great, I'm sorry. So the topic this week is acute coronary syndrome, STEMI, and the fact that time is tissue in this diagnosis. A STEMI is basically an ST elevation myocardial infarction. It typically consists of the anterior descending artery of the heart becoming completely blocked, and you can see that on EKG by the ST segment of the EKG being elevated. This is typically called the widowmaker, in that a lot of our patients die from this issue. There's a couple ways that we treat this issue, and the most important thing is that it is done in a timely fashion. First of all, when a patient's diagnosed with a STEMI, EMS needs to be activated, and they need to give the patient nitroglycerin to help dilate the blood vessels of the heart. They need to give them aspirin to help anticoagulate the blood, and also give them oxygen so they can increase the oxygen perfusion throughout the tissue. Once the patient gets to the hospital, the number one thing we want to do is give them PCI, or percutaneous intervention on the patient. The patient's typically taken to the cath lab, and the cardiologist will insert a tiny little balloon and snake that up through a vein, through like something like the femoral artery, and it will go all the way to the heart and find the area of blockage. And at this point, the cardiologist will inflate the balloon, and this causes the blocked vessel to expand, and for hopefully blood to pass by the clot and get to the rest of the heart, and this helps with reperfusion. Another treatment that we do, which is not used as often anymore, is fibrinolytic therapy. It's also called clot buster. The reason we use this still is because a lot of hospitals don't have cardiac cath labs yet, so we still have to rely on fibrinolytics. The clot busters, they go towards the clot, and they actually help break the clot into pieces so that the blood can finally perfuse again. Something that also might happen is a patient will be taken to a hospital that doesn't have a cath lab, and they will be given fibrinolytic therapy, and then hopefully transferred to a hospital that does have a cath lab, and there they will have the PCI done. Fibrinolytic therapy should be done within 30 minutes of a patient arriving to the hospital. That's very important so that they can get the maximum amount of the clot disintegrated and reperfusion established, and PCI should be done within, I think, 2 to 3 hours. Otherwise, the heart, the tissue just begins to die off. It's without oxygen for such a long period of time, and unfortunately, as we all know, heart muscle does not regenerate, so time is tissue. If we do not get the heart reperfused within the time frame, then the patient's not going to have a good recovery. They're probably going to die. Some barriers to STEMI patients getting the treatment that they need is the fact that a lot of patients, they'll take themselves to the hospital rather than call EMS, and this means they have a delay in treatment. They're not getting the aspirin, the oxygen, or the nitroglycerin to first help their heart like they do when they're in the ambulance. And they might, have delayed treatment because they don't get taken to the hospital through the through the ambulance. They sign up at the station. They have to explain all their issues, and it just delays their treatment. Also, a lot of heart attacks and STEMIs are often, a lot of patients think they're having some other illness rather than a heart attack, so they might just not even go to the doctor. Anyways, I'm going to go to the Smithsonian and have a really awesome day. I hope you guys have a great week. I'll see you later. Bye.